Imagine being in the prime of your life, yet suddenly everything changes. Strokes don't only affect the elderly, in fact, a startling 1 in 5 women under the age of 50 will experience a stroke. Today we're diving deep into a topic that could save lives, the warning signs of a stroke in women. Many of us believe that strokes are a concern only for the elderly, but that's far from the truth. As women, our bodies might show us signs in ways that are subtle yet urgent. It's crucial that listen to and understand these signs. There's a common myth that strokes are solely the concern of older generations. However, the reality is different and often more severe for younger women. Our focus today will delve into those unique, sometimes overlooked symptoms that are critical for every woman to recognize. Number 1, sudden numbness or weakness. Imagine this. You're going about your day the same as any other. Perhaps you're typing away at your computer, preparing a meal, or just enjoying a walk. Suddenly, without warning, your arm goes limp, your grip fails, or your leg refuses to cooperate. This terrifying experience isn't just a random occurrence. It could be one of the first signs of a stroke. Such was the case for Maria, a 35-year-old graphic designer and mother of 2. One morning, as she reached for her coffee cup, her hand just wouldn't listen. It felt like trying to move through thick, invisible mud. This sudden weakness gripped her with fear. It was like part of me was just gone, Maria recalls. Thankfully, she remembered what she'd heard about stroke symptoms and immediately called for help. This sign, sudden numbness or weakness, especially on one side of the body, is a silent alarm. It's your body's way of signaling that something is critically wrong. For women like Maria, recognizing this can be the difference between recovery and lasting damage. In these moments, every second counts. Strokes can be stealthy, but the signs are clear if we know what to look for. Awareness is our first line of defense. Let's empower ourselves with knowledge and vigilance. Because when it comes to our health, especially with something as serious as a stroke, being informed is not just necessary, it's life-saving. Number 2, confusion or trouble speaking. Imagine you're in the middle of a normal conversation, a routine phone call, or perhaps giving a presentation at work. Suddenly the words don't come out right. You struggle to form coherent sentences, or your speech might slur inexplicably, as if your brain and mouth are no longer in sync. This isn't just a moment of forgetfulness or a slip of the tongue. It could be one of the vital warning signs of a stroke. This symptom, where speaking becomes a struggle or where your thoughts become jumbled, is deeply unsettling. It's a stark and immediate change that feels as if someone has flipped a switch in your brain. One minute you're fine, and the next you can't express yourself or understand what others are saying. It's not just frustrating, it's frightening. Experiencing such an episode is a clear signal that something serious is happening within the intricate wiring of your nervous system. It's an urgent reminder that your brain, the command center of your body, might be in distress. Recognizing this can save not only the quality of your life, but very possibly your life itself. In these moments, swift action is crucial. Remember, when it comes to a stroke, time is the brain. Every minute counts. Educate yourself and others about this sign. Number 3, trouble seeing in one or both eyes. Imagine sitting down to read your favorite book or focusing on a distant object, and suddenly your vision blurs or part of your visual field disappears. It's as if a curtain has been drawn across your eye, blocking part of the world from view. This alarming change, occurring without warning, could signal a stroke and should never be dismissed as just fatigue or a momentary glitch. This symptom, trouble seeing in one or both eyes, can manifest subtly, beginning with perhaps a slight dimming or blurring of vision that many might attribute to tiredness or age. However, it's crucial to recognize that these visual disturbances can indicate that your brain is experiencing critical disruptions in its ability to communicate with your eyes. The suddenness of this change can be frightening. One moment your world is clear, the next, it's as if you're looking through a fogged-up window. This isn't about needing a new prescription. It's a serious neurological warning that requires immediate attention. Understanding this sign can be a life-saving measure. If you or someone you know experiences sudden changes in vision, act promptly. Number 4, sudden trouble walking, dizziness, loss of balance or coordination. Imagine you're walking through your home, a place where every step is familiar, when suddenly your legs don't seem to follow your lead. You might feel dizzy as if the room is spinning, or you might find yourself swaying, struggling to maintain balance. This isn't just clumsiness or a momentary lapse. It could be a critical warning sign of a stroke. This sudden difficulty with walking, accompanied by dizziness, loss of balance, or coordination, is alarming. It disrupts your body's basic functions, which we often take for granted. The floor may feel unsteady, or your own feet might seem unresponsive. It's as though your body forgets how to do what it has done effortlessly for years. These symptoms can create a scary and confusing experience. Being suddenly unable to control your movements or feeling as if you might fall at any moment is not only disorienting but also a sign that something serious is happening in your brain. Such symptoms demand immediate attention. They are your body's urgent plea for help. Recognizing and reacting to these signs promptly can make a significant difference in outcomes. If you or someone else experiences these sudden changes, it's essential to seek medical help right away. Number 5. Severe headache with no known cause. Imagine being struck suddenly by a headache so intense that it feels as though your head is in a vice. This isn't your typical headache that might follow a stressful day or come from a lack of caffeine. It's severe, debilitating, and appears without any obvious trigger. Such a headache could be more than just a minor annoyance. It could be a critical warning sign of a stroke. This type of headache differs significantly from others you might have experienced. It comes on abruptly, reaching peak intensity in a matter of seconds or minutes, and it's often described as the worst headache ever experienced. This isn't something to simply brush off with over-the-counter pain relievers or a quick nap. The sudden onset of such severe pain is alarming, and rightfully so. It acts as a dire warning that something potentially life-threatening may be occurring within the brain, such as bleeding or a blockage in the blood vessels, which requires immediate medical intervention. Understanding and recognizing the nature of this symptom as a possible stroke indicator is crucial. If you or someone you know experiences such a sudden, unexplained severe headache, it's imperative to treat it as a medical emergency. Quick response to these signs can be life-saving, drastically altering the outcome by minimizing brain damage and enhancing recovery prospects. Remember, when it comes to potential stroke symptoms, taking immediate action isn't just cautious, it's essential. Stay informed, stay vigilant, and never hesitate to seek help when these severe symptoms arise. Number 6. Fainting or seizure. Imagine engaging in a routine activity when suddenly, without any warning, you or someone near you collapses. This abrupt loss of consciousness, known as fainting, or experiencing a seizure, where control over bodily movements is lost, can be terrifying. These dramatic events aren't just alarming, they could be potent signs of a stroke. Fainting or a seizure during a stroke may occur when the brain's blood supply is abruptly disrupted. This disruption affects the brain's function so severely that it can no longer maintain normal consciousness or control over the body's movements. The experience is not only physically dramatic, but also emotionally distressing for everyone involved. This symptom demands immediate attention and action. It isn't just about the person collapsing, it's a sign that something critical is happening inside, a sign that could mean life or death. It's crucial to understand the gravity of these symptoms. They're your body's urgent signal that it's in distress. If you witness someone fainting or having a seizure, especially if they have no history of such conditions, treat it as a medical emergency. Number 7. Fatigue or general weakness. Imagine a day where every task feels unusually exhausting, where your body seems to weigh more, and even small efforts leave you disproportionately tired. This isn't just the weariness from a poor night's sleep or a busy week. It's a profound and pervasive fatigue or a sense of general weakness that seems to come out of nowhere. This could be more than mere tiredness. It might be a warning sign of a stroke. This type of fatigue is distinct. It's not just about feeling sleepy. It's an overwhelming sense of drained energy, where even speaking or moving your arms feels like a formidable task. Similarly, general weakness, especially if it's sudden, affects your ability to perform everyday activities, signaling that something serious may be happening within your body's neurological or vascular systems. Recognizing this symptom is crucial because it's often the most subtle and easily overlooked sign of a stroke. People tend to attribute their fatigue or weakness to overwork or stress, not realizing that their body is possibly signaling a life-threatening condition. Understanding this can make a significant difference in responding appropriately. If you or someone you know experiences such sudden and unexplained fatigue or weakness, it's important to take it seriously and seek medical attention immediately. Quick and decisive action can be crucial in treating a stroke and can significantly improve the outcome. Next, preventive measures and what to do. When it comes to strokes, prevention is just as critical as knowing how to react to the warning signs. Implementing lifestyle changes and maintaining awareness can significantly reduce the risk of experiencing a stroke. Here's what you can do to protect yourself and your loved ones. Maintain a healthy diet. Opt for a diet rich in fruits, vegetables, whole grains, and lean proteins. Reduce your intake of saturated fats, cholesterol, and high-sodium foods to help manage blood pressure and cholesterol levels, both of which are risk factors for strokes. Regular exercise. Engage in moderate physical activity for at least 150 minutes per week. Activities like walking, swimming, or cycling can help maintain healthy blood pressure and weight, reducing the risk of stroke. Monitor health conditions. Keep a close watch on blood pressure, cholesterol, and diabetes. Regular checkups and managing these conditions with your healthcare provider can drastically lower your stroke risk. Quit smoking and limit alcohol consumption. Smoking and excessive alcohol consumption increase the risk of strokes. Quitting smoking and moderating your alcohol intake can significantly improve your overall vascular health. Know your family history. Understanding your family health history regarding strokes and heart diseases can help you and your healthcare provider make more informed decisions about your health. Recognize the signs of stroke fast. Use the FAST mnemonic to remember the signs. Face drooping, arm weakness, speech difficulties. Time to call emergency services. If you suspect that you or someone else is having a stroke, act immediately. Time is crucial in the treatment of strokes. The quicker you get to a hospital, the better the chances are for recovery and reducing potential damage. Remember, in the event of any signs, it's better to call for emergency medical services right away, even if the symptoms seem to pass. If you found this video informative and want to keep enhancing your health knowledge, make sure to subscribe to our channel. We regularly post valuable health insights, expert advice, and comprehensive guides that empower you to make informed decisions. By subscribing, you'll join a community committed to better health and early detection of serious conditions. Don't miss out. Click the subscribe button and the notification bell so you never miss our updates. Together, let's prioritize our health and take proactive steps towards a healthier future. Thank you for watching, and see you in the next video.